Hi, everybody out in Facebook land. It is Dr. Holly Lucille here from Natty PTV. I'm going to mention it again. I really should say Natural Partners Full Script Television. Yep. I don't know why that makes me so happy just to say that, but tons of content just about to come at you. You know, we've been talking a lot about the endocannabinoid system, how fascinated it is, how we sort of stumble upon it, what it does, what it is in our body. But today, we're going to be talking about hemp-based products, our phytocannabinoids, because we have our own endocannabinoids, but we're going to be talking about phytocannabinoids, the appropriate dosing of them, what should be prioritized, how it should be managed. Are there any contraindications in using these products? What's the difference between the products? What do you look for when you're choosing a brand? And how should a practitioner actually assess the ECS or endocannabinoid system? And to do that, I have got the esteemed Dr. Hector Lopez with me finally. It's so great to have you here.
Oh, thanks for having me on.
Yeah, so I'm going to just read and brag a little bit about you. You are a board-certified specialist in physical medicine and rehabilitation, highly regarded consultant to professional athletes and the nutritional supplement industry as a product developer, a researcher, and a writer. So you are really, I think, the perfect person to have this conversation with. So what factors, as practitioners, should we really weigh and prioritize when it comes to dosing, when we talk about all of these different phytocannabinoids?
Yeah, so I think that's a great question. And this area of hemp-derived phytocannabinoids is really an area where, you hear it all the time in terms of really personalizing and customizing your dose to the patient or to the consumer. And this is an area where you have to take that to an even higher level because the phytocannabinoid dosing regimen is going to be so individualized. You're going to have your patients titrated. You're going to start low, you're going to go slow, and you're going to slowly titrate them to the point where you're getting a maximum benefit with minimal adverse reactions or adverse responses. So one of the things we have to do is you have to discuss about product type. So when you look at product type, you have CBD that's available in isolate form,
right,
which means that it's just the cannabidiol 99, usually it means it's a 99% cannabidiol isolated compound.
Right, got it.
And this is available in two different forms on the market currently. When you look at the over-the-counter market, let's just call it broadly the over-the-counter market.
Sure.
There's synthetic cannabidiol, so it can be synthesized with total organic chemical synthesis in a lab. And then you have the isolate, that's a crystal isolate, but it's still derived from the hemp cannabis sativa plant. And this is the reason I say this is important is because your patients or your consumers and practitioners should be aware of where the CBD isolate is coming from.
Okay.
If the CBD isolate is coming from a total organic chemical synthesis, then it's been shown that it's actually a different stereoisomer than the one that is naturally biosynthesized in the plant. And what that means is that the synthetic CBD isolate is actually going to have some activity at the CB1 receptor.
Okay.
So patients can actually say, hey, yeah, I started taking this product. It's a CBD isolate. It's a really cheap product, very cost effective. But I am sort of feeling like I'm getting a little buzzed or I'm getting high. I'm actually getting a little euphoric. They can actually feel somewhat impaired or intoxicated. And that's because the synthetic CBD isolate it actually has some activity at the CB1 receptor.
Okay.
Whereas the hemp-derived plant-based CBD isolate that is extracted into a 99% isolate, such as even the pharmaceutical product that's out there, the Epidiolex, which actually it's appropriate. We're speaking. It just got FDA approval yesterday, right?
Yeah.
So that is also plant-derived, and that one does not have activity at the CB1 receptor, and hence patients will not get a feeling of euphoria or high or intoxicated from it.
Yeah. So you're right. I mean, it sounds like we're taking individualized medicine to the next level with these particular products because it depends on the difference in the products, which is kind of coming up to my next question, and also very much on the individual and what their endocannabinoid system is actually doing and what we're trying to achieve. But in summation, and correct me if I'm wrong, I think one of the golden rules is go slow. Go.
Start low and go slow.
Go low and go slow.
Yeah, definitely start low and go slow. And we only talked about the 99% isolate, Dr. Lucille, but we also have the full spectrum hemp-derived product, which are going to be
talking about
lower
the difference between these products.
Yes, yeah. I think that's important for practitioners and consumers alike to be aware of. So
Sure.
You've got this 99% pure CBD isolate that's available in oil or soft gel or capsule. Right. And then you have what's known as full spectrum hemp-derived CBD. And what that means is that you're taking the plant and you're extracting, usually using, if it's a reliable brand or a reliable company, you're going to be using the supercritical fluid CO2 extraction method. And what you're doing is you're extracting not only the CBD, but you're also going to be extracting a whole host of other phytocannabinoids and terpenes and flavonoids and all these other bioactive compounds that gives you this sort of symphony of activity. And that's the reason why people say, well, I'm confused. This CBD isolate, like for example, the Epidiolex product from GW that was approved, is dosed at 20 milligrams per kilogram body weight. So that you can go up huge doses with the isolate. You can go up to 1,200 to 1,500 milligrams, right, per day. Whereas with the full spectrum, where you have CBD plus you have a little bit of, you may have trace amounts of THC, you may have CBDA, CBG, and a bunch of other cannabinoids. That dosing is probably going to range in somewhere between as little as, we've had patients in our lab respond to as little as 3 milligrams a day, all the way up to as much as 60 to 75 milligrams.
So big difference.
Big difference, yeah, in terms of doses of active CBD, because when you bring in all those other compounds, you kind of get this, Dr. Raphael Mechoulam said that he calls it the entourage effect.
Yeah, the entourage, great. So you get that synergy. And I think that's what's so beautiful about plant medicine in general, is using that whole plant and all the constituents and how beautifully they can synergize together and create a benefit. So any contraindications in using any of these products?
Well, anytime you're dealing with a product, even a natural product, that has bioactivity and physiologically it's active, in particular, phytocannabinoids are metabolized by the cytochrome P450 system, like many compounds, like many xenobiotic compounds.
A lot of other things that we ingest.
Right. Including drugs and medications.
Mm-hmm.
So I think it's important to just work with your practitioner, having patients and consumers working with their practitioner, with their hopefully a healthcare practitioner who is comfortable in dealing with botanicals and herbals and botanicals and phytonutrients, and understanding that there's the cytochrome P450 2C9, 2C19, and 3A4. Those are the three main enzyme systems. So physicians should be aware that any drugs that use that pathway, you should certainly be careful with starting to dose patients on a phytocannabinoid hemp-based CBD product. And then there's other contraindications, the obvious things like hypersensitivities or allergies to hops. So I would say not just cannabis, because some patients may never have tried cannabis, right? But if they know they have an allergy to hops or some other botanicals in that family, then you should also have practitioners and patients should again be wary and be careful, be leery and careful of dosing for hypersensitivity allergy.
Yeah, great point. So there are metabolized through the cytochrome P450, those three different enzymes. So if there's anything else on board that is sharing that pathway, could be downregulated, would take that into consideration in the clinical picture as far as dosing is concerned.
Absolutely.
When assessing the ECS, I mean, I think this is what's fascinating to me. We talked about the endocannabinoid system in a couple shows back, and that we have these, CB1, CB2 receptors, our own endocannabinoids. How do you encourage practitioners to actually assess? Now, obviously, if I'm doing a physical exam on somebody, I can do a 72-point physical exam, from a neurological perspective, from a digestive perspective, from listening to the heart, listening to respiratory system. How do we kind of use the tools that we have to actually assess somebody's ECS so we know better how to utilize these products that are coming more and more available?
Yeah, that's a great question. So we're still in essentially the nascent stages, as you mentioned, right, of really evaluating and assessing and investigating the ECS, especially in traditional Western medicine. So what we do know is, and actually Dr. Ethan Rousseau, who's a pain specialist, a medical doctor, very renowned in the cannabis space. He actually has written a couple papers on the clinical endocannabinoid deficiency syndrome. So he talks about the concept of endocannabinoid tone. I think you brought that up even before, maybe in your previous discussions, right? You mentioned
Sure.
with the ECS. And so what you really do is, what does the ECS affect? Well, it's so broad and it's
That's the thing.
so right, it's so general that I think you hit the high notes, and the high notes of what the endocannabinoid system is affecting is essentially it's affecting the nervous system to a great degree. So you look at neurologic stability, you look at things like anxiety and mood, and how is someone dealing with stress? I would say stress resilience or stress management. So
Great.
while we typically, I think, as practitioners, think of the like the sympathomimetic and adrenal system and thyroadrenal system, when you think somebody's presenting with stress or they're not handling stress very well, what it's their baseline cortisol status, et cetera. Now there's an opportunity for you to also think of the endocannabinoid system in terms of how someone is sleeping, how they're handling stress, how are they waking up in the morning? Are they waking up in the morning and not feeling restored? And again, these are very broad and general issues that can come up with generalized fatigue and chronic fatigue syndrome and fibromyalgia and a lot of chronic pain issues, migraine, clinical headache or migraine issues,
I mean, it seems like,
gastrointestinal, GI stuff too. Yeah.
yeah, and it seems like such, we are at the nascent stage, but I think everybody should stay tuned and get into this, because what you're speaking about, in my opinion, are really difficult clinical modern day issues that people get into all the time. And this brings an entire new level of assessment, and it brings an entire new level of treatment, in my opinion, in the essence of doing no harm, like first doing no harm and perhaps using plant medicine, and also using something to perhaps balance out something that's inside of our system. So doing the best thing that we can to actually fuel that body's inherent healing system. And so I just think it's fascinating.
Yeah, you're right. It's another great tool in your toolbox now,
Yeah.
right? Of all these your therapeutic armamentarium. Now you have another great tool to attack, as you say, many of these modern day high stress scenarios, and again, you're doing it with a very high, what we call therapeutic index, meaning a high opportunity to affect someone therapeutically without really getting into many of the adverse effects and adverse reactions.
One last question for you.
Yeah.
Um, what should people, both consumers and practitioners, be looking for in a brand that is manufacturing these products?
Yeah, I think to determine a high quality CBD providing brand, a CBD, you want to make sure that obviously they're talking about having full traceability. So you want your company or your brand to know that they can follow the product from essentially from seed to shelf. We like to say sometimes that the brand has control of the entire supply chain. So I think that's important, that they have their seed characterized so that they know that they're actually starting with a hemp cultivar of cannabis sativa, and not a marijuana or drug cultivar of cannabis sativa.
Right.
That allows you to already start from a plant that will already be manufacturing and synthesizing higher levels of CBD and much lower trace levels of THC, and still allow you to bring in some of the other phytocannabinoids and bioactives with it. I think some of the other things to look for is the brand sponsoring their own research? Do they have data, for example, on toxicology or safety? I know there's only really a very small minority of brands in the non-drug market that do offer products that have toxicology data, like generally recognized as safe status as a foundation, and that are even sponsoring clinical research. I know that we're starting a couple of clinical trials right now in that space. We're lucky to be probably the first CRO that's going to be doing human clinical trials on an actual commercial product that's a hemp-derived CBD product.
That's great. That's going to be awesome. So much more to come. I would just say OMG CBD and then some. Dr. Hector Lopez, thank you. You are a wealth of knowledge. You have a wonderful vocabulary, and I could talk to you.
Thank you.
Forever.
Thanks, Doc. Yeah, no, that we should do this. We should do this again. We should do this again.
We will definitely do this again because there's going to be so much to talk about, and I think we just are scratching the surface as far as this being value to not only practitioners but to the people that we serve. So I really appreciate it. Y'all stay tuned because it is a new field, and we are going to continue to bring it to you. But we're signing off for now. Until next time.